Hey everybody, it's Dr. Heyer from Holistic Health and Chiropractic of Frankfort. Today is Tuesday, September the 11th. Hope you're having a great day enjoying this beautiful sunny weather we have here in Chicago. This month we're going to be talking about how we use and utilize nutrition in the office and what we use it for. Nutrition is a huge topic. You don't have to go very far on the internet, on your Facebook, Google nutrition. There's a bazillion things that come up. Here's the problem. There's a lot of bad information out there, and there's a lot of good information as well. But as a layperson or as an everyday Joe, how do you sift through the good information from the bad and figure that out? Well, you got to remember the internet isn't there to diagnose you. And once it can't diagnose you, it really doesn't know how to tell you what to do next. But a lot of people like to self-diagnose and self-prescribe, and that's not always good. It's not always a good idea. Even us doctors, we're taught in school not to self-diagnose ourselves, but to go to our colleagues and get evaluated and exams done, and then make a game plan. So what I'd like to do on the next few weeks is share with you how we utilize nutrition in the office and our system and our procedures for that. So it's real simple. We do three things when it comes to nutrition in our office. The first thing we would do with somebody who's coming into the office is give them a NutriQ questionnaire. Well, what's that mean? Well, we have a questionnaire that's about 322 questions, which is really in-depth, that gives us a really good idea of what's going on underneath or causing their health issues. Now you may be wondering, well, why do I need to do a questionnaire? Can't I just tell you my symptoms? Yeah, you can. The problem is that's how the medical profession works. It's going based on symptoms and treating symptoms. Symptoms are like the tip of an iceberg. Think of an iceberg. Only 10 to 15 to 20% of the iceberg is above water. And there's a huge amount of iceberg underneath the water that you can't see. Symptoms are like the very top that you can see. They're tangible, they're visible, but the underlying cause can be hidden deep underneath. So what we like to do is we start with a questionnaire that gives us an overall picture of your health and what's going on. Second thing we do, yes, just like the medical doctors, we want to look at the blood work as well and any labs that have been done. The problem is that many patients who come to us, well, they tell us that they had the blood work done and their medical doctor says everything's normal. Or maybe they had some thyroid tests done and their endocrinologist says everything's fine. But yet the patient doesn't feel fine. They still feel fatigued, they feel overrun down, they feel they're overweight, they're having a hard time losing weight or just fatigue. They're having some issue going on and the blood work is saying that they're, quote, normal. Well, you wouldn't be normal if you're feeling that way, something's not right. And so we want to look at the blood tests as well, but at a deeper, with tighter parameters. And we'll get into that functional evaluation later on. The other thing that we do is called functional tests. And those are tests like food sensitivity tests, like we've been talking about the last couple of months here since April, or functional stool studies, or what we'll be talking about in the near future, a brain span test. These are tests that look at how the body is actually functioning. It's not just chasing abnormal chemistry or symptomatology, but we'll get into that in more detail on our next video. And the third thing I do is called contact reflex analysis, or CRA. And that's a really cool test that I do in the office that is based on the acupuncture system. And we challenge the body by doing muscle tests to see what are the priorities today. You know, somebody may have a sniffle or sinus issues, but that might only be the symptom. There may actually be deeper underlying issues that we can find with this muscle testing that really opens up the patient's eyes and gives me a much better direction of where we need to take the patient. So in our office, we do three things. We do a nutritional questionnaire, we look at blood work, and oftentimes we'll order the blood work, especially if maybe there have been some tests that have been overlooked or haven't been ordered, as well as blood work and functional tests. And we do the contact reflex analysis. And after I have those three results, I have a much better idea of what direction we need to take the patient to restore their health and their well-being. So I want to wish you a great day. We're going to actually build on this over the course of the next couple of 2 or 3 weeks and get into deeper tests so that people can learn a little bit more about what is available, especially since many of our patients come to us who are just not getting answers the conventional way. And sometimes they need to look at an alternative or a functional approach to get answers to getting their health back. So have a great day. Talk to you later.